earlier that over 70% of us are obese. We know, especially from the pandemic, that comorbidities, diabetes, hypertension, heart challenges, cholesterol are all connected to being overweight.
We like to form a physician-patient partnership. We work together. We find out what are the goals for the patient in front of us, right? Because every patient is different.
Welcome to Doctors Hospital West Imaging Suite, where advanced tech meets compassionate care. Our friendly staff guides you on a journey to better health. Through cutting-edge technology, we prioritize accurate diagnostics. Our imaging team ensures your comfort, while our detailed x-rays and advanced CT scans aid precise diagnosis. Our dedicated team ensures minimal wait time and guarantees prompt and efficient care. For more information, visit our website or give us a call. Doctors Hospital, trusted and best care, now in the West.
The very first time that I asked my mom to buy me something related to weight loss, I was in the 3rd grade. I wanted a slim, fast shake to take for my lunch. And by the 4th grade, I will never forget hearing 2 of my fellow choir members discuss how much my thighs were bigger than everybody else's. And of course, as your morning TV show host for many years, your favorite greeting for me when you would see me in the store was, "But you're so much bigger on TV." The great Bohemian way to always talk about weight. If you have lived and navigated gaining weight, losing weight, being told about your weight, if weight is now a concern for you as you look towards your future, then this is a conversation that you do not want to miss. I'm Anastarcia Palacious, and it is my absolute pleasure to be your guest host this morning. And joining me is my good doctor from Grand Bahama, Dr. Rolands. Dr. Rolands, welcome to the Doctors Hospital podcast, and thank you so much for being with us. Please tell us about yourself.
Thank you so much, Anastarcia. It is a pleasure to be with you today. Well, I'm a physician, as you mentioned. I happen to have a specialty in family medicine. I have been practicing medicine since 2012, and I'm very interested in helping Bahamians to achieve the healthiest lifestyle. And of course, weight loss is an important part of it for those people who are obese or overweight.
Indeed it is. Indeed it is. And we know statistics here show, as I mentioned earlier, that over 70% of us are obese. We know, especially from the pandemic, that comorbidities, diabetes, hypertension, heart challenges, cholesterol are all connected to being overweight. And so the question that I kind of want to understand is, what is obesity? Can we start there? Because for many people, especially when this conversation comes up that we're going to be having today around Ozempic, Mounjaro, the weight loss drugs that have recently come on the market in the form that they're in, when people hear that, they say, well, why can't you just exercise? Why don't you just change your diet? And I think that it's a bigger conversation than that. And unless you've journeyed through it or have the medical knowledge, you may not understand that. So what is obesity in and of itself?
Okay, that's an excellent question. Obesity, simply put, is a disease. You see, normally our body balances the energy that we put in the form of food that we eat with the energy that we burn. That is by exercising and just performing our activities of daily living. People living with obesity have developed a difficulty in achieving a healthy balance between the energy that they put in and the energy they burn.
Okay. So people with obesity have this. Now, what I've also heard is that for people who are obese, their relationship with food may look different. So, for example, they may have something called food noise, which is where they actually think about food more often than someone who may not be obese. Have you heard about that?
Certainly, I've heard of food noise. It exists, definitely.
It exists. And then given that it does exist and that people are managing and struggling with this, how then do these new drugs, what they call GLP-1s, work to help people curb that food noise and to help them to actually start to lose the weight?
Yes. Okay. Interestingly enough, GLPs slow down the passage of food through the stomach.
Okay.
That means that people feel full longer and they think about food less.
Okay. But now we've heard, and there's, with nutrition and health, there's always different subtopics, things coming up, trends, that sometimes it's better to eat more, that you do smaller meals more frequently so that you increase the metabolism. But you're saying that with these GLP-1s, people are saying, slow it down so you think about it less and this works?
Actually, what is happening is that the passage of food through the gastrointestinal tract is being slowed. We feel satiated longer, and therefore we are less likely to feel hungry and to eat more. It's interesting. There have been some very good studies that have compared people on GLPs to people who are exposed to buffets. And people on GLPs have been shown to eat approximately 20% less.
Okay. All right. So we got the evidence here. The research is here. Let's talk about that research, because it's my understanding that the drugs that we're most commonly aware of, we hear the word Ozempic, now we hear sometimes Mounjaro, and those were not FDA approved up until 2 years ago. But is it my understanding that people have been being treated for diabetes with this from before that? Could you give us some information on how long these drugs have been on market?
After rigorous research, the US FDA approved these drugs for the treatment of diabetes in 2005. And so that was when they were first used. And so for over 20 years, these drugs have been shown to be safe and effective. And what is interesting is along the way, we realized that they were very helpful for weight loss and for coronary heart disease protection.
Okay.
So that's why they've become, 2 years ago, the US FDA approved them for the treatment of obesity.
All right. So someone who is afraid to take this drug because they think it's too new, we can say to them then that while it is new in terms of being marketed for weight loss specifically, it has been on the market for 20 years.
Over 20 years.
Correct.
20 years. And prior to that, there was rigorous research that was done.
Okay. And what is that research telling us why people should be excited for this? Can we really see lives change as a result of taking these drugs?
Absolutely. Absolutely. Studies have shown that even a 5% weight loss can affect one's risk of some of the very serious complications that are associated with heart disease. With obesity, you mentioned some of them. Heart disease, for example, diabetes, for example, some types of cancer. Even depression is more common in people that are overweight and obese, right? So taking these medications that have been shown to cause, in some cases, on average, 15, sometimes 20% weight loss from baseline can help to reduce the risk of some of these very, very serious diseases.
Okay. So let's talk about again how this kind of works, because I know that for many people who struggle with weight loss, it is not a new thing. They have journeyed for a long time, and they have done the exercise, and sometimes they lose the weight and then they put it back on, and they've tried to eat healthy, and again sometimes they lose the weight and they put it back on, and then very often after a certain age, that weight loss and the ability to lose it quickly really slows down. And so for those people, would this drug help them, and how long do they need to take it?
Okay, excellent question. The studies have shown that it is extremely effective. Extremely effective, yes, in helping people to lose somewhere up to 20% of the weight. It doesn't have to be exactly that much. 50% of the people will not lose that much, and some will lose a little bit more. Okay, but on average, somewhere in that range, 15 to 20%, depending on which of the drugs is being used. Okay. And studies have shown that for some people, maintenance therapy will be necessary. Some very important, very well-respected bodies, for example, the American Academy of Family Physicians refers to injectable weight loss medication as a potential long-term medication. So people may need to continue it.
Okay. So people may need to continue it. And of course, these are the things that you would assess if they took this medication.
Yes.
So let's kind of talk about that process then. Here in the Bahamas, this has become more popular over the last year.
Yes.
And there are many different people offering these weight loss drugs. Some people are asking you to come into our office and they inject you. And some people are utilizing going to the pharmacy, collecting the drug, and then injecting themselves. Is there a better way? Is there a way that you suggest that people go about injecting these drugs?
Okay. For Doctors Hospital, our patient safety is paramount. That is crucial to us. And there are some very specific reasons why people should not take these medications. Before we counsel a patient, we ensure that it is safe for these patients to take it. For example, should I give you a list of some of the reasons a patient shouldn't take it?
Definitely. Please let us know.
Okay. For example, people with severe diabetic eye disease, they're not encouraged to take it. People with certain endocrine disorders, for example, thyroid disease, parathyroid disease, pancreas diseases, women who are pregnant or breastfeeding, people who have chronic kidney disease, People who have gallbladder disease. These are just some people who should not be taking this medication. And because patient health is much more important to us than anything else, we will not offer these drugs unless we have had the opportunity to do a thorough exam, take a history, do the blood test and analyze the blood test to make sure the drug is safe for them.
All right. Well, thank you so much for saying that, because safety is paramount.
Absolutely.
And I think one of the myths around this, or the confusion around this, is it safe? Is it safe? And you don't know it's safe unless you do this testing, right? Because each of our bodies are made up differently. How we interact with medication, even the creams we put on our skin is going to be different.
Absolutely.
And so knowing those things is critical to determining whether or not this is the right drug for you to take. So that being said, this program that Doctors Hospital is offering, it includes this consultation that you mentioned?
Absolutely. It begins with a consultation. We like to form a physician-patient partnership. We work together. We find out what are the goals for the patient in front of us, right? Because every patient is different, right? We do this assessment that I talked about. Thorough history, physical exam. We analyze the blood test, and then we decide, is the patient eligible for the drugs? We discuss the potential risks and benefits, including potential side effects with the patient. And then after that, we enlist a qualified nutritionist to give the patient advice, because at the end of the day, healthy behavioral modification is very necessary. We need them to understand how to eat healthily, how to count calories, how to exercise, and why exercise is so important, not only for weight loss, but for maintaining the weight loss. So this is a part of our program.
All right. So you mentioned additional things. So not only does this entire process or program that we're going to be sharing about, giving you some more details as we continue on, include a consultation where you go in and you make sure that you have done your blood work, you've done your annuals, that the doctors know what's happening in your body.
That's right.
Not only does that happen, but once those things come back and they can find the suitable drug for you,
right,
then you are connected with a nutritionist.
That's right.
And you are monitoring them and even encouraging them in types of exercise.
Exactly.
So this is a full holistic program.
Absolutely. And it needs to be.
Okay. And so it's not a miracle then. So that means that even though you're taking the drug and it can help, you still have to do some other things with it.
You must.
Okay. Okay.
To lose and maintain the weight loss. Absolutely.
All right. So to lose and maintain, there will be some shifts needed. But the beautiful part about these drugs is that because they help with that food noise, because they help with that desire to continuously eat, you are probably more likely to achieve those goals now than you might have in the past with just diet and exercise alone.
Exactly.
Okay. All right. And then, let's consider then that a patient comes in, they pass all of your exams and they are now ready to start the drug. You mentioned that Ozempic and Mounjaro might be a little different. Is there one that is going to cause weight loss faster? Is there one that will require you to take higher doses of it? How are those drugs different?
Well, it's going to be patient dependent, right? So definitely we start at low doses and we may titrate up, right? Studies have suggested that Mounjaro is a little bit more effective, right? And also provides some atherosclerotic cardiovascular disease risk, although they're both very good. I do not want to suggest otherwise. Mounjaro has been shown to be a little bit more effective.
Okay. And then let's talk about the patient taking the drug now. So they've done the tests, they get the injection, and then within a few hours, maybe there are symptoms. What are some things that patients on these drugs should be looking out for in order to make sure that they're not having a negative reaction or that it is working as it ought to, especially after that first dose?
Okay. Well, by far, the most commonly reported side effect is GI upset. So as we noted, the medication works by slowing down the movement of food. So sometimes you'll have nausea associated with it. Some people experience diarrhea and some people experience constipation. These are known reported side effects. And by far, these are the most common ones. Some far less common ones, as you mentioned, might be an allergic reaction, right? Another one that might happen is that the person might develop, very, very rare, pancreatitis or gallbladder issues. Those are just some examples of things that might happen.
Okay. Let's also talk on that then, because I was telling a friend this morning that I was coming in to have this conversation, and she was like, I don't know. I just don't know if it's safe. There's so many things that can go wrong. And I said, well, things can go wrong. We're taking Tylenol, right? Like taking an aspirin can cause things to go wrong. And so it's just important, again, that we have this consultation to begin with, and that we're journeying with a doctor that cares about the symptoms, so that you are aware that things can happen with anything.
That's right.
But if the good outweighs the negative in this instance, for example, should you not take these drugs and you're more likely to develop diabetes, hypertension. You also go on medications for those anyway, right? So is it not better to prevent that by perhaps taking these drugs now with the understanding that yes, things can happen, but it's not common. And in the instances where it is uncommon, you then as doctors would be able to say, okay, this is the course of action.
Absolutely.
Okay, all right. And then, so we know that you can go ahead, get the medication. Once it's injected, you look out for these symptoms. There may be some changes in the GI tract. Would that happen week after week after week, or that's just from the initial dose?
It's patient dependent.
Okay. Yes. Okay. So all patient dependent. All right. And then when we consider these medications and you consider the testing that goes into making sure that this is right for the right people, have you all successfully seen some of your own patients already beginning this program?
Yes. Yes. And they're very happy.
They are.
And I am so happy. I'm excited.
That's good to know. That's good to know. All right. In terms of long-term use again, and we look at the cost of this program, are we able to justify the cost when some people are out there giving it away slightly cheaper? So for example, the Doctor's Hospital program is $400 for your initial assessment, all that blood work in the labs we spoke about. And then it's $600 per month. And that includes what?
Yes. First of all, I want to clarify that for the $400 is for someone which we're beginning with at baseline.
Okay.
They haven't had an annual. They have no labs on our records, right? For people who have had their annual, yes, we may need to add some additional testing, but it may not add up to the $400, right? We may need to definitely check, for example, pancreatic health. We might check for some enzymes, for example. We might check some thyroid, hormone levels and things like that. But you might not necessarily need to have all of the full workup again if you have recent blood tests in our system. Okay. And that might make the onboarding, as we call it, the first visit a little bit less expensive. Okay. And then, as you said, afterwards, for the Ozempic, it's going to be $600 a month. And that includes your follow-up with your nutritionist, right? That includes your weigh-ins, and that includes your counseling with us and the medication. And the Mounjaro is $700.
Okay. And so in terms of this relationship, this patient-doctor relationship, I know that, of course, you talked about doing the weigh-ins. Would that happen once a month?
Yes.
All right. And then are you in communication with the doctor throughout that time?
You certainly can call us at any time. We often check in with our patients. We call these telehealth to see how they're doing, particularly in that first crucial period when they're starting the medication. And we let them know that they should not hesitate. They can certainly reach out to us.
All right. So suppose someone needs this, right? It can really be a game changer for them in terms of losing the weight, getting all of those numbers in place that should be in place, that you're preventing diabetes, you're preventing hypertension, preventing heart disease. They come in, they get the first injection, it goes well. But then they're now left to inject themselves and they have a fear of needles. How does that work?
Well, certainly, we can encourage people to come and we are more than willing to help them with that.
Okay.
Sure.
So that should not prevent people.
Oh, no.
Okay. All right. So that's good to know, because I know some people are like, I want to do it, but I'm terrified of sticking myself. And so that is something that you'll work with patient by patient.
Sure.
Okay.
Absolutely.
Okay. Good to know. All right. And then in terms of the people who say, oh, this is just a shortcut, you're cheating, this isn't worth it because you're too lazy. How do we address that mindset?
Well, we've already established that obesity is a disease, right? And we understand that the backbone of healthy weight loss and maintaining a healthy weight is always going to be a healthy, balanced, nutritious, lower calorie diet and regular exercise. They are the backbones. So diet medications are only a support to that backbone.
Okay. All right. So again, I want to emphasize that it's not a cheat code. First of all, somebody's getting themselves injected with something, so that's never exciting for anyone. But also the fact that this program in and of itself also focuses on that nutrition, also focuses on that exercise. And so it really is a holistic wellness approach that includes the support of these medications. And if you're someone who's never struggled with weight, you may not understand how much that support is needed. But so we want to encourage you to continue to listen to podcasts like this one so you can understand that while this is an assisting measure in terms of this drug, it also comes with this holistic approach in order to maintain long-term. And for anybody wanting to take the drug themselves, that idea that there are going to have to be some shifts in diet and in exercise in order to maintain long-term. All right, excellent. So why do you think the doctor's hospital is the best route to take in terms of getting this medication?
Okay, that's an excellent question. And I'm very happy to say we are safe. We are doing everything we can to ensure that this drug is given in a responsible and safe manner. We develop this physician-patient partnership. We understand our patients because we listen to our patients. We try to find out what matters most to them, what their weight loss goals are, and then we work with them to achieve it. And on top of that, we bring in other experts. We have a nutritionist come in. So we form a lifestyle coaching team to help our patients achieve their best, healthiest weight.
Okay. And if there was one myth about GLPs that you could debunk, what would that be?
Okay, that's a good question. I would say I need people to understand that they support a healthy lifestyle to help people achieve it.
Okay. So they are support.
They are support. They're not the quick fix and all. It's a part of a system.
So we spoke about obesity and we identified it, as an actual disease and something that these GLPs can help with.
Sure.
But I'm wondering if there are levels to obesity.
Okay.
In that, people talk about BMI, which is what again?
Okay, excellent question. Body mass index is the amount of weight someone is carrying for their height.
Okay. So the amount of weight someone's carrying for their height. And obviously, there should be a proportion to that. I'm thinking about that from a mathematical perspective.
Sure.
And when it's over a certain proportion, that's when the person is overweight and then obese.
Exactly.
But there are some people who may be 40 pounds overweight. And then there are some people who may be 200 pounds overweight. Does the difference in obesity, do you characterize it differently as doctors?
Sure we do. So for obesity, by definition, is someone whose body mass index is 30 kilograms per meter squared. That's the unit we use. And so class 1 obesity is when their body mass index is somewhere between 30 and 34.9. 30, that's called class 1. Class 2 then would be from 35 to 39.9, right? And class 3 is 40 or greater. And just for some understanding, healthy weight is considered, for example, by the United States Centers of Disease Control to be between 18.5 and 24.9 kilograms per meter squared.
Okay. So one of the things people have said is like those measurements may not take into account people of color and their heritage. Is that an excuse for us to continue to eat poorly, or is that something that should be considered?
I think it's worth considering, but I don't think it's an excuse for eating unhealthy foods. At the end of the day, we want people to eat balanced, nutritious, lower calorie meals.
Okay. Fair enough. I just had to ask because I know that's a conversation that happens often.
Sure.
But understanding that these classes exist.
Yes.
Obese class 1, obese class 2, obese class 3. Would the approach to losing that weight look different by class? So, for example, if somebody is 400 pounds, is a GLP-1 like Ozempic or Mounjaro their best option, or should it be something else?
Okay, that's an excellent question. In order to answer that thoroughly, I would need to actually assess a person's BMI, right? But I can give you some general rules of thumb, right? Generally speaking, the injectable weight loss medications are recommended for people with BMIs 30 or greater, right? And so that means that by definition, they're obese. Or a person with a BMI of 27 and a weight-related medical condition, for example, diabetes or heart disease.
Okay.
Generally speaking, that is the case. Generally speaking, for people with what we call class 3 obesity, we might want to consider perhaps a bariatric surgery or some sort of surgical management, which has also been shown to be very effective. And very often these days, the injectable weight loss medication is used in conjunction with bariatric surgery. There are people, for example, who may not be eligible for a surgery immediately.
Okay. And so in those instances, you would try to bring that weight down.
You might, yes. And that would be something that a conversation they would have with their surgeon.
Yeah. And this is good because it's a reminder to me of another question I had for you, because we see in many of the spotlights of this disease, we live in such a social media age. You see influencers using these GLP-1s. You see celebrities using these GLP-1s, some of whom don't appear to need it. We don't know their medical history. And I'm glad that you mentioned, if the BMI might be about 27, but there is disease associated with that, like diabetes, like hypertension, then this might still be an option. But for those people who are not at this BMI, who are using this drug, let me rephrase it. Is it a little irresponsible for people who are not at that BMI to continuously use this drug? Or is it just my choice?
Well, I really would have to have more information to be able to answer that honestly and fairly. I don't want to judge anyone without, and I want to give honest and accurate advice.
Okay.
So I need more information.
Okay, that's a good answer, though. All right. I guess for me, I always wonder when people say, well, is it safe or is it not? I always think if you don't have to take medication, don't take it.
Mm-hmm.
But if you do, then you would fit into the categories that we've discussed, and then it's a help to you.
Mm-hmm.
But again, not a doctor, and the doc said we're not judging anyone. We are going to allow people to make those decisions based on their decisions with their doctors and their medical facts.
Exactly.
But here at Doctor's Hospital, you would be assessed to determine what is best for you.
Exactly.
Because Doctor's Hospital does have a variety of weight loss options. So it's not just GLP-1s.
Absolutely.
Okay.
Absolutely. Yes. Bariatric surgeries, and we've had some great success in that area as well.
Okay.
Mm-hmm.
And are you able to speak to us about maybe any patient cases of someone who started this GLP? I know this program is relatively new.
Yes.
But have you seen anyone, even in the weeks that we've started doing this medical weight loss program, with success?
Yes, I certainly have. And I'm very excited about it. And so are they.
Okay.
Mm-hmm.
Okay. How many pounds so far?
10 so far.
What?
Yeah.
Exciting. All right. Good stuff. Well, I think that, again, we've been showing how this works. Once we add it in with nutrition, once we add it in with exercise, once you have the doctor's support, that this is actually a very good option depending on that obesity class. And of course, once you come in and do the assessment with Doctor's Hospital, they'll know where to put you and where to direct you based on all the weight loss options Doctors has available.
Mm-hmm.
Dr. Rolands, one of the things we mentioned is one of the reasons that this particular program through Doctor's Hospital is so special is because it is safe, right?
Mm-hmm.
It's about making sure that you do that consultation, that you know and do the right labs, just determine where your body is before we can determine which medication might be best. Somebody listening to this might say, okay, well, I'm overweight, but that's it. I don't have diabetes. I don't have hypertension. Or somebody may say, I do have diabetes. I do have hypertension. Can people who are already dealing with communicable diseases come in and still take this drug?
Okay. Excellent question. And it would depend on the disorder. For example, we know people with certain endocrine disorders should be discouraged from taking these medications, which is why we do the tests that we do. Mm-hmm. And I'd have to answer that based upon the patient in front of me and the medical conditions we're specifically speaking at that time.
Okay. So, for example, I had a TIA, which of course is a passing stroke for those who may not be familiar with the term. Mm-hmm. Would that exclude me from this medication?
Mm-hmm.
Okay. All right. So every patient, based on patient history, based on their test analysis, that is when it's determined whether or not this drug is free.
Absolutely. Okay. And that's the way it should be done.
It should be done that way. Individual patient care to emphasize safety.
Mm-hmm.
All right. Well said. Thanks, Doc.
Thank you.
So suppose somebody hears this conversation. They come in, they get the labs done, they sign up, they're ready. You give them the first dose, and then they have an allergic reaction to it. Mm-hmm. Very rare, of course, but it does happen in some instances. What would that person's next course of action be? Because I imagine that, for some people, this is a hope. Like this, they are excited about this opportunity because they've just never had it before. And then you take the medication after the consultation process and your body, for whatever reason, rejects it. What happens next for a person like that?
I definitely need them to come in and see their doctor immediately. Okay. Immediately. Mm-hmm. We'll take it from there.
Okay. We can take it from there. Yeah. All right. Well, are there any other final words that you want to share with our audience today about GLPs and about what this means to you to see your patients and the transformation that's happening in their lives?
Yes, thank you. I'm excited about this opportunity for everyone because, as you rightly said, it's really sad that 70% of the people in our country are overweight or obese. And this is something we need to do something about. So I want to see people learn as much as they can, come in and see us. We're happy to have this conversation with you. If you need more information, our number is 302-3250, or you can look at the website, clinics.doctorshosp.com/weight loss, please.
Okay. And this is available. You actually flew in from Grand Bahama today.
I did.
So I want to make it known that this is not just available at Doctor's Hospital here at New Providence.
No. Also in Grand Bahama, at Freeport Medical Center, at Kabbalah Medical Center, and in Exuma. Yes.
Okay. Mm-hmm. That's exciting. And it's very exciting because, of course, when we talk about the 70% of Bahamians being obese, that's not Nassau-centric.
No.
That is the entire Bahamas.
It is.
And so we can see those changes in islands like Grand Bahama and in Exuma, and maybe eventually even further out. Mm-hmm. We'd really be doing something phenomenal for the nation.
That's right.
Yeah. All right. Well, it's been an absolute pleasure talking with you, Dr. Rolands, and I'm just learning more about these GLPs and what they mean. I kind of want to emphasize some points that I got from you. The first being, that obesity is a disease and it ought to be treated, I think, not with scorn and distaste, but with the same level of care and concern that we have for somebody that has cancer or that has diabetes or hypertension, right? So recognizing that obesity in and of itself is a disease, it has a set of characteristics, and then that this is a support to treating that disease.
Exactly.
And that for some people, this support will require maintenance long-term, but all that can be figured out with your doctor. Of course, the Doctor's Hospital is doing this as a partnership, patient and doctor. And that means that you're not alone in the journey, both in the support of the medication and in the process. Get done. That at Doctor's Hospital, you get the consultation first. So you got to make sure that everything is in order for the right person to get the right medication or to determine if this is not the course.
Exactly.
Okay. And that once this medication starts, you're going to have a nutritionist working with you, a doctor checking in on exercise. And so you have a partnership that's supporting the journey, both in medication and in people. I think I got it?
Absolutely.
Okay.
Well,
all right. Well, Dr. Rolands, thanks so much again for joining us. Any final words for us?
Thank you. That was wonderful.
Okay. Well, it's been an absolute pleasure to speak with Dr. Rolands here and to be a guest host for this Doctor's Hospital podcast, learning all about weight loss drugs and what they mean for you, right? We get one shot. See what I did there? And making it better for all of us to feel better and to feel healthy. So this is something you're interested in. Please, Dr. Rolands, could you tell me again where they can go to learn more?
Sure. So please feel free to go to the website clinics.doctorshosp.com/weight loss. And the telephone number is 302-3250.
Welcome to Doctors Hospital West, your trusted healthcare partner. Our warm and friendly staff ensure a positive start to your visit. Kindly complete this form. Relax in our comfortable waiting area where we prioritize timely care. Our compassionate medical team addresses a range of urgent healthcare needs. We provide on-site lab and imaging services for quick and accurate diagnosis. Your health is our priority, and we're here every day to serve you. To learn more, visit our website or give us a call. Doctors Hospital, trusted and best care now in the West.